walk around the neighborhood, feeling blessed, never stressed.
Hi guys, my name is Sanjay Gupta. I am a consultant cardiologist in York, and today I wanted to talk to you about how anxiety and stress can cause chest pain. Okay, chest pain is an incredibly terrifying symptom for many patients because the automatic assumption is that the pain signifies a heart attack waiting to happen. And I would always say that if anyone is experiencing chest pain, it's always a really good idea to go and seek medical advice and ideally see a cardiologist to ensure that the discomfort is not due to a lack of blood supply to the heart caused by a narrowing in a blood vessel that takes blood to the heart muscle. Okay, now this is more tends to be heart artery narrowings which cause chest discomfort, i.e. angina, tend to be a lot more commoner in older patients, i.e. patients above the age of 45 to 50, and in patients who have lots of risk factors like smoking, diabetes, high blood pressure, a family history, etc. This video is really for those people who have already been and seen a cardiologist and undergone the tests to exclude heart artery narrowings. And they have subsequently been told that, look, your pains are not due to heart artery narrowings. So we don't think it's your heart which is causing the pain. And whilst this is reassuring for patients, it still doesn't leave them any wiser as to exactly why they're getting the pains, because the pain is undoubtedly uncomfortable. And the fact that they don't know why they're getting it is obviously something that causes a great deal of anxiety. Now, when we do angiograms as a cardiologist, when I do heart tests, I often send patients for an angiogram. And if the angiogram is normal, I come back to them and say, look, your heart arteries are clear. The pain is not coming from your heart. And then the patient says to me, well, what could it be then? And I say to them, well, it could be your stomach, it could be indigestion, it could be spasm, so that although your heart arteries are normal, maybe they go into spasm for temporarily, and maybe that stops the blood getting to the heart, and maybe that causes your discomfort. Sometimes we also make the assumption that it could be something called microvascular angina, which is that our tiny blood vessels that you can't see on an angiogram, maybe they're narrowed, and that's what causes the discomfort. And often people ask me, well, could it be due to stress? And I say, yes, it could be due to stress. So today I wanted to try and clarify exactly how stress and anxiety can cause chest pain. And this video may really be useful because if you are one of those people who is continuing to get chest pains and you've been told your heart arteries are normal, then understanding what I'm going to talk about will probably help you understand the condition, but also may allow you to try and do things that can make it better for you. All right. Now, the main way in which stress and anxiety can cause chest pains is due to hyperventilation. Okay. Hyperventilation is when we overbreathe. Now, we know that about 60% of those patients who come to us with chest pain and in whom we think, oh, it could be coming from the heart, we do the angiogram, which is the gold standard investigation, and we find that the angiogram doesn't show any blocked arteries. 60% of those patients are subsequently found to have hyperventilation as a cause of their symptoms. So what is it about hyperventilation? Why do people with hyperventilation develop chest discomfort? And there are lots of different mechanisms, and there are at least 3 or 4 different types of chest pains you can get when you have stress and anxiety causing hyperventilation. The first thing to understand is that when we hyperventilate, we reduce the amount of carbon dioxide in our bloodstream. Okay, carbon dioxide, so normally we breathe in oxygen, we blow off carbon dioxide. When we're hyperventilating, we're blowing off lots of carbon dioxide. And that can upset the acid-base balance in our blood. Carbon dioxide contributes to the acidic content in our blood. When we blow off a lot of carbon dioxide, we actually reduce the acid in our blood and make it more alkali. And the effect that has is calcium and magnesium in our bloodstreams move from outside the cells into the cells. And that leaves less calcium and less magnesium outside the cells. Now, when calcium moves from outside into the cells, it leaves less calcium outside, and that can result in pins and needles. So it is not uncommon for patients who have hyperventilation-induced chest pain to complain of pins and needles. Sometimes they can also complain of numbness around the mouth, okay? The second thing to say is that when you get more calcium inside the cells, it can cause the blood vessels to tighten up, and it can actually cause spasm, all right? And we know that when you hyperventilate, in fact, the coronary arteries tend to constrict, and the blood supply to the heart gets less transiently, and that can also cause discomfort. And sometimes that discomfort can be indistinguishable from angina. People can often complain of heaviness or a tightness going down both arms, and that can be indistinguishable from angina. It is also worth knowing that when you're hyperventilating, you're increasing the amount of adrenaline in your body, and you can increase the amount of adrenaline in your body by up to 3 times. And adrenaline makes the heart beat harder. So a lot of people will then say, look, I'm getting this, and I also get this thumping, or my heart is thumping away, particularly if I'm lying on my left side, it hurts, and I feel tender on the left side of my chest, just where my bra was, for example, in women. So that's another mechanism. So there are 3 or 4 different types of discomfort that have been described, okay? Number 1, some people will complain of a mainly dull left-sided ache in the chest. And we think that that happens because when you're hyperventilating, you're working the rib muscles, the intercostal muscles are working really hard, all right? And they can get tired. And when they get tired, they can cause discomfort. And that discomfort can be manifested as a left-sided pain just above the left breast over here, and that's a dull ache. Some people will describe a very sharp, transient, piercing or stabbing pain in the chest, and in those patients they often say, oh, and I'm feeling my heart really thumping away because of all this adrenaline that is being released by the hyperventilation and the upset in the acid-base balance in the blood. And these people, interestingly, will get more ectopics as well, and they often describe the ectopics as incredibly painful. All right? And then, as I say, a few patients will also describe this heaviness in the chest, like someone sitting on their chest, which, to all intents and purposes, is the same as angina. Angina feels like that, but I just want to re-stress the point that if you're getting it and you haven't been checked out, you must get checked out. But once you've been checked out and been told it's not your heart, then that could be another mechanism. It could be another mechanism because the heart arteries start constricting when your acid-base balance gets upset, when the calcium levels inside the cells go up, and that can also cause the discomfort. So the point is that these can all be symptoms which can be caused by hyperventilation, all right? And also it's worth noting that when you have all these symptoms and the adrenaline is excessive, it can sometimes even cause the ECG to change slightly. So these are not, these can all be explained by symptoms of stress and anxiety and hyperventilation. So if you are getting them, and if you have been, once you've been checked out by your cardiologist, and if you are continuing to get these symptoms, then it is worth thinking about your breathing. And I've got some breathing exercises that I'll put on my Facebook page, and trying those breathing exercises and deliberately slowing your breathing down at that time. And if you slow your breathing down and start taking deeper breaths in and stop over breathing, then that would relieve your symptoms. And for a lot of people, a lot of people get put on all these tablets and they're told, oh yeah, you have angina, you have angina. Well, if your heart arteries are not narrowed, then it's highly unlikely you have angina. It may well just be something like overbreathing or hyperventilation syndrome. And doing some regular breathing exercises will sort your problem out without you having to resort to medication. But as I say, please, 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 if you haven't been checked out by a cardiologist, it's very important you get checked out first. Please do not, do not feel falsely reassured by this video without being checked out first. But if you have been checked out, then this could possibly explain why you get the discomfort. So I'm going to try and put this paper on my Facebook page soon, and I'll try and find some breathing exercises, and I'll put those on my Facebook page, and I hope this is useful to you. As always, I am incredibly grateful for every thing you say, everything you do for me. I'm blessed. I'm blessed to have people write to me and say such nice things. And I will continue trying to put some videos out. Thank you so much. And if you get a chance, please do come by and visit my Facebook page, and also visit my website, which is www.yourcardiology.co.uk, and my email address is yourcardiology@gmail.com. I know a few of you have written to me and I haven't replied, but I promise I will soon. All right, all the best. Take care. Bye.